Hello, my name is Dr. Carlo Oger, emergency physician and founder of edexitvideo.com. Today we're going to talk about hand-foot-mouth disease. Hand-foot-mouth disease, HFMD, is a common viral illness of infants and children. The disease causes fever and blister-like eruptions in the mouth and/or a skin rash. The illness itself. The disease usually begins with a fever, poor appetite, malaise, feeling like it's unwell, and often with a sore throat. 1 or 2 days after the fever onset, painful sores usually develop in the mouth. They begin as small red spots that blister and then often become ulcers. The sores are usually located on the tongue, gums, and inside of the cheeks. A non-itchy skin rash develops over 1 to 2 days. The rash has a flat or raised red spot, sometimes with blisters. The rash is usually located on the palms of the hands and soles of feet. It may also appear on the buttocks and/or genitalia. A person who has hand-foot-mouth disease may have only the rash or only the mouth sores. The cause of hand-foot-mouth disease. It is caused by various viruses that includes polioviruses, Coxsackie virus, echovirus, and enteroviruses. Coxsackie virus A16 is the most common cause of hand-foot-mouth disease in the United States, but other Coxsackie viruses have been associated with the illness. Hand-foot-mouth disease is spread from person to person by direct contact with infectious virus. Infectious virus is found in the nose, throat secretion, saliva, blister fluid, and stool of infected persons. The virus is most often spread by persons with unwashed, virus-contaminated hands and by contact with virus-contaminated surfaces. Infected persons are most contagious during the first week of the illness. The virus that caused HFMD can remain in the body for weeks after a patient's symptoms have gone away. This means that the infected person can still pass infection to other people even though he or she appears well. Also, some persons who are infected and excreting the virus, including most adults, may have no symptoms. HFMD is not transmitted to or from pets or other animals. Factors that increase the chance for infection or disease. Everyone who has not already been infected with an enterovirus that causes hand-foot-mouth disease is at risk for infection, but not everyone who's infected will become ill. Hand-foot-mouth disease occurs mainly in children under 10 years old, but can occur in adults as well. Children are more likely to be at risk of infection and illness because they are less likely than adults to have antibodies to protect it. Such antibodies develop in the body during a person's first exposure to the enterovirus that caused hand-foot-mouth disease. Infection results in immunity to the specific virus that caused the hand-foot-mouth. But since it is caused by many different viruses, you can still get it again. How is the diagnosis of hand-foot-mouth disease made? Hand-foot-mouth disease is one of many infections that result in mouth sores. However, healthcare providers can usually tell the difference between hand-foot-mouth disease and other causes of mouth sores by considering the patient's age, the symptoms reported by the patient or parent, and the appearance of the rash and sores. Samples from the throat or stool may be sent to laboratory to test for the virus or to find out which enterovirus caused the illness. However, this can take 2 to 4 weeks to obtain the test results, so generally it is not done. Treatment and medical management. There is no specific treatment for hand-foot-mouth disease. Symptoms can be treated to provide relief from pain from the mouth sores and from fever and aches. Pain and fever can be treated with over-the-counter medicines such as aspirin, but we don't use aspirin in kids. Mouthwashes or sprays that numb pain can be used to lessen the mouth pain. Fluid intake should be enough to prevent dehydration. It's important to prevent. A specific preventive form for hand-foot-mouth disease is not available, but the risk of infection can be lowered by good hygiene practices, like washing your hands frequently and correctly, cleaning dirty surfaces and soiled items, including toys, first with soap and water, and then with disinfecting them with cleansing solution of chlorine bleach. This is made by 1 tablespoon of bleach in 4 cups of water. Also avoiding close contacts like kissing, hugging, sharing or eating utensils or cups with other people that have the disease. There is no vaccination available to protect against hand-foot-mouth disease. Complications from the virus infection that cause hand-foot-mouth disease are not common, but if they occur, medical care should be sought for immediately. One potential complication is viral or aseptic meningitis. This can be presented by fever, headache, stiff neck, or back pain. The condition is usually mild and clears without treatment. However, some patients may need to be hospitalized for a short time. Other, more serious diseases such as encephalitis, swelling of the brain, or polio-like paralysis can result but are very rare. Encephalitis can be fatal. So, in summary, this is a viral illness. It's very common, especially in kids. There is no special test to be done. We just treat the symptoms. If you develop any significant systemic symptoms like dehydration, persistent headache, chills, stiff neck, or anything that would concern us for a secondary infection or a progression of the disease, then you must call your doctor immediately or go to the emergency department. For more videos like this, please visit edxitvideo.com. Remember, these are for advice only and should never replace the advice of your physician or true medical care.